the busy crossroads of Taiwan, a place where there are countless of vehicles passing the brightly illuminated streets. This particular view is not uncommon. You will find a myriad of billboards and many lights endeavoring to catch one's attention. This specific light, however, is all too familiar to the Taiwanese population. With its significant rods of light shining a variety of colors consecutively, these lights are unmissable. In the early dawns, these businesses will have their busiest hours. This is betel nut, also known as the Taiwanese chewing gum. Many countries in Southeast Asia have betel nut producers and consumers. Here in Taiwan, betel nut is also regularly chewed on. Commonly known as betel nut, this product has many names. The more accurate one would be betel quid, but it is also known as the Taiwanese chewing gum as it gives a fresh feeling when chewed on. In India, they will call it pan or pan. In Mandarin, it is called binglang. The terminology betel nut is not quite accurate because it is not a real nut. Instead, it consists of the seed of a berry from the Areca catechu palm wrapped in the leaf of the betel plant. Its scientific name is Piper betel. The betel leaf will induce a hot and spicy taste and sensation. The Areca palm seed and betel leaf will be accompanied by slaked lime. Slaked lime is calcium hydroxide. This chemical will cause microcuts in the soft tissue of the mouth, causing toxic substances to easily penetrate the body. The taste of betel nut will primarily be described as bitter and not too pleasant among most people. It comes in many different shapes and sizes, tastes and colors. The slaked lime can either be white or red. For convenience, we will keep referring to it as betel nut, as this is the primarily used term. The betel nut generally contains betel leaf, areca seed, and slaked lime. It may contain tobacco and many other substances such as spices can be added. This includes cardamom, saffron, cloves, aniseed, turmeric, mustard, or sweeteners. These ingredients are added based on local preferences. Different countries will have different ways of consuming the betel nut. In Taiwan, there are two main types of betel nuts. One will be the classic Areca palm seed wrapped in betel leaf with white slaked lime. The other one is a half-opened Areca palm seed with the stem of a betel plant inside smeared with red slaked lime. When chewing on the betel nuts, the betel nut will surely develop a clear red color. Betel nuts will usually be spat out after chewing, making the environment unclean. These remnants of betel nut can be regularly spotted on the streets of Taiwan. Due to the red nature of chewed betel nuts, many users will develop discolored teeth.
Male like beta quid, but the female did not like beta quid. So the incidence rate of oral cavity cancer in Taiwan in women is so lower than the men because the woman did not like the beta quid, because the beta quid will induce the teeth discoloration, so they have the bad appearance. So Taiwan women did not like beta quid. The male to female ratio is so different. That is, the women in Taiwan had the more health lifestyle than men. But in India, there are so many female oral cavity cancer patients because they like beta quid.
But why would people chew on these betel nuts? Betel nuts have an 8 times stronger effect than coffee when it comes to energization. Betel nuts are mostly used among the lower class income population, and the usage is more prevalent among blue-collar workers, such as truck drivers and construction workers.
Do people around you chew betel nuts?
People around me,
No, but my mom works at a construction site, so I think like some construction workers they're like in the 50s or 60s. I think some of them chew betel nuts. Yeah.
They might use the betel nut to feel more awake when they are working because it enhances one's alertness. It will also give people a feeling of refreshment, and that is why it is popular in these high-temperature countries.
提神啊，让开车、长途车，嘴巴有再咬一咬就精神比较好，这样而已，不会说会提神或怎样。
Culture will also play a big role. After years of chewing, betel nut will become normal as it is integrated into someone's environment. This may increase the chance of being influenced into using betel nuts as well. Many betel nut sellers are small local businesses. They are sometimes even run by the whole family, causing the children to help prepare the betel nuts together with the adults.
那你们平时一天会卖多少槟榔呢？
不一定呢。
不一定吗？
生意好坏现在不一定。
哦。那现在吃的人多吗？
还好。
还好。蛮多的哦。那你们自己吃，每天吃几粒的？
不一定啊，几颗我们都是这样吃一吃，好玩的吃一吃，这样不像人家真的吃的很多啦。
那会不会吃了就睡不着？等一下。
这个不会啊。
不会吗？
Oral cavity cancer is the 16th most common cancer of the world. It is the 11th most common cancer in men and 18th most common cancer in women. 65.8% of oral cavity cancer in the world is in Asia and 17.3% in Europe. It is especially common in Southeast Asia, South Asia, and the West Pacific Islands. There are so many people with oral cancer, especially in Papua New Guinea. They have the highest incidence rate of all cancers in the world. Betel nuts are consumed by more than 600 million people in the world. Research suggests that chewing betel nuts will increase the risk of oral cancer by 7.9 compared to never having chewed betel nuts before. And how about in Taiwan? According to a population-based survey in Tainan city in 2009, the amount of betel nut chewers among men of 20 years and older was 12.3%. Approximately half of the oral cancers reported in Taiwan are attributed to betel nut chewing. This is also the case for the Indian subcontinent. In Taiwan, 53.7% of the oral cavity cancers are induced by betel nut consumption. According to the Taiwan Cancer Registry from 1980 to 2019, the age-adjusted incidence rate in 1980 was 419,000. The highest incidence rate, 2,859,000, was in 2014. But from 2008 there has been a plateau. In 1980 the male usage was increasing substantially, and in 2008 the incidence reached a plateau status. The female incidence of oral cavity cancer was still steadily increasing slowly. 90% of all oral cancers in Taiwan were male. Taiwan has the highest male-to-female ratio of oral cancer in the world, about 10 to 1. More than 90% was squamous cell carcinoma. These patients have a lower socioeconomic status. They have low education or health or lifestyle. Oral cavity cancer may be induced by genes. Fanconi anemia may especially cause oral cancer. Only a small group of patients develop oral cavity cancer caused by the human papillomavirus. Environmental factors play a big role in inducing oral cancer, especially the sun exposure. Some frequent sun exposure induces lower lip cancer. This is mostly the case in darker toned skin. Another big factor is poor lifestyle. Unhealthy lifestyle choices such as smoking, drinking alcohol, betel nut chewing, and poor dental hygiene. Poor oral hygiene may increase the microbiota in the mouth, creating higher risks of oral cancer. Smoking, drinking alcohol, and chewing betel nuts will lead to more carcinogen exposure. At first, those are small irritations, but it then damages the mucosa, which will lead to malignant transformation with consequences of cancer. When diagnosed with oral cancer stage 1, patients may have an 80% chance of survival. But when diagnosed with stage 4 oral cancer, the survival rate will be lower than 40%.
The cigarette and the alcohol. So they will kind of combine effects. You quit the beta quid, but you still smoking. So in the smoking will induce the oral cancers. Beta quid is easy to quit, but the cigarette is more difficult to quit. Beta quid is a little easy than smoking to quit. So they have a synergistic effect.
Betel nut has been classified as Group 1 carcinogen by the International Agency for Research on Cancer. So, betel nut has a carcinogenic effect. This is caused by the substance arecoline, which is a nicotinic acid-based parasympathomimetic which is found in the seed of the areca palm berry. Comparable to the effects of nicotine, this alkaloid will make someone feel more energized, euphoric, relaxed, and alert. As for the carcinogenic effects, the arecoline creates DNA instability and reduces the tumor-suppressing effect of the gene p53. Not only arecoline, but other carcinogens present in betel nuts such as safrole and eugenol also play a role in the formation of oral cavity cancer. Other problems derived from betel nut usage are also cancer-related. It is correlated to oropharyngeal, hypopharyngeal, and esophageal cancer. Betel nuts will also induce poor oral hygiene. Some may lose their teeth or have difficulty swallowing.
How do you think the general people in the population view betel nut as a society?
I think most of the people, they don't like people to chew the betel nut because when you chew the betel nut, it's not good for your appearance and also it's unhealthy.
Environmental problems also should not be ignored. When the betel nut is chewed upon, the rest of the betel nut is spat on the ground, leaving residual betel nut fibers immersed in red saliva.
Some of the old men, they chew betel nut and they also spit on the street, so it's not good for the environment and also for their own health.
What is your stance about betel nuts?
Well, it's bad for health, and when people chew it, they spit it on the floor, so it's also bad like for how the city looks like.
Because they will swallow the juice. They will not swallow the areca nut. They will swallow the juice. The juice will induce esophageal cancers and the stomach cancer. So they will split out that's the fiber of the areca nut. They chewing the beta quid and they split out the saliva and they split out the residual fiber. And they sometimes will swallow the juice. The juice will induce esophageal cancers.
Oral cavity cancer can be divided into 7 subsites, including the lip, tongue, mouth floor, gingiva, retromolar, and hard palatum. It is treated with a tumor-wide excision of the as soon as possible. Sometimes when the case is severe, parts of the neck will be dissected as well. Reconstructive surgery and post-operative chemotherapy can also be indicated. The usual oral cancer surgery takes about 12 hours to complete and many difficulties need to be overcome. So how should betel nut be combated? The main demographic for betel nut users are residents with a low socioeconomic status. This means that most of the consumers had only had education levels up to elementary school or junior high school. Studies show that there are definite correlations between a low socioeconomic status and the chewing of betel nut, the smoking of tobacco, and the drinking of alcohol. Many people with a higher education level, such as high school or college, will have better insights on the negative impact of betel nut. This means that an important part of prevention of betel nut usage is appropriate education on the subject, whether it be in school, medical institutes, or social events.
Growing up, did you get a lot of education about the effects of betel nut?
Yeah, for sure. All of our teachers and parents, they usually told us that it's unhealthy for us, and also it usually causes cancers in the oral area.
Yeah, we do have like health education on betel nuts and as well as drugs and cigarettes. Yeah.
The Taiwanese government is already trying to implement these measures.
Especially in our clinical practice, I will strongly recommend those patients to stop contact with the beta quid.
Primary prevention with the help of adequate education about betel nuts is step one into the solution. Another tactic of prevention Taiwan has already implemented to reduce the amount of severe case oral cancers due to betel nut is to do oral cancer screening. This secondary means of prevention will filter out many people with pre-malignant stages of cancer. This way the oral cavity cancer can be treated in early stages, which will reduce the number of late-stadium oral cavity cancer and increase the survival rate.
On the next year or maybe the 5 years later, because we do the oral screening in Taiwan, the whole people oral screening. So I think we screen out more and more the oral cancer patients, and then maybe 5 years later they will decrease.
Even though the government of Taiwan is carrying out many ways to reduce the amount of betel nut chewers and lower the catastrophic effects of betel nut, there are still people that do not listen to the recommendations to stop using betel nut.
其实吃这个也不好啦，但是没办法，有的人就有那个习惯了，这尝试不好，而且尝试一下而已就好，但是有的就是改不了。
他们习惯了，
他就那个有一个口馋那个习惯，就这样。不然抽烟也不好，就是那么多人要抽，没办法，人性。
Apart from medically related problems, financial problems will also play a part when looking at betel nut consumption. When an oral cavity cancer patient develops a cosmetic complication such as swelling, they cannot go back to work and provide stable incomes for the household. Also, many betel nut vendors are dependent on the selling of betel nuts to be able to put food on their table. So, when trying to lessen the betel nut consumption and availability, many small businesses are put into jeopardy. The industry is big, and these financial drawbacks are a difficult issue to overcome. So, betel nut is a highly popular snack among blue-collar workers, mainly used by people with a low socioeconomic status. This Taiwanese chewing gum is the primary cause of oral cavity cancer due to its carcinogenic components. Even though many people are aware of the problems it might cause, there are still many betel nut consumers. Similar to alcohol and tobacco, these substances are difficult to quit and remove completely from the commoners. Taiwan is currently promoting healthy lifestyles by providing education to those that may need it. Also, the oral cancer screening program has a massive impact on the reduction of severe oral cavity cancer cases. There are, however, many financial, psychological, and social problems that need to be taken into account. Unfortunately, we have not encountered oral cavity cancer patients or chronic betel nut users themselves, though we hope to have established a clear insight into the betel nut problem. Taiwan is on the right track to battle the betel nut problem, but still a long road is ahead of them to eradicate this issue.